Hello everybody, welcome to my YouTube channel Homeopathy Super Sessions by Dr. Jargus. Today I'll be continuing the lecture series of Richard Hughes, namely lecture number 5. It deals with the knowledge of medicines. So in this lecture, Richard Hughes will tell us how to gain the knowledge of medicine. He'll compare it to the Hahnemannian knowledge, saying that the proving has to be done on a healthy human being. But Richard Hughes also says that the provings can also be done on the lower animals, which Dr. Hahnemann strongly resented. Richard Hughes also tells you two ways of knowing the knowledge of medicines, that is the empirical method and the rational method. And he also tells us about other methods in order to gain the knowledge of medicine. So let us see about this chapter, lecture number 5. In the introduction, in the last lecture 4, Richard Hughes spoke about the knowledge of diseases. He gave importance to the phenomena called clinical, in which importance is given to the symptoms of the drugs, expressions of disease, both subjective and objective, and evolution of the disease phenomena. So basically, Richard Hughes has given importance to the clinical aspect, wherein you have the symptoms of the drug, then the expression of the disease, that is the subjective and the objective. Subjective is what the patient feels, objective is what the physician sees, or the patient can also see it, or it is seen by the friends and relatives, whoever is accompanying the patient. And naturally, also you have to know how the disease started, that is the evolution of the disease phenomena. Besides this, the classification of disease and the pathology to diagnose the seat of disease will help the selection of the indicated remedy. So you also have to classify the disease and also know what is the pathology behind the disease, so as to gain the location or to diagnose the seat of the disease, which will help you in the selection of the indicated remedy. The classification of disease helps in grouping the drugs around definite morbid groups. So when you classify the disease, you can come to know certain groups of drugs belonging to that particular class. Pathology will help in locating the seat of disease. Thus, the above 2 points require the symptoms to be taken into consideration to determine which medicine will be the similibum in order to treat the disease condition. So, classification of the disease and the pathology, both of them will help us to select the similibum. Thus, to arrive at the true conception of the case, you must understand the dynamic origin of disease along with the subjective symptoms and the pathology involved. So again, he's reminding us that the homeopathic concept of disease is dynamic in origin, and we have to take the expressions of the disease, that is the subjective and the objective symptoms, and also whatever pathology is there. Now let us go on the topic of knowledge of medicine. So now let us focus our idea on the knowledge of medicines. They are the tools required for the healing art. So naturally, whatever medicines are there in homeopathy, they are the tools for which we require for the healing art. The best definition was put forth by Hahnemann in 1805 in the preface of his Fragmenta de Verbis Medica Mentorium de Positivis. So it was written in Latin language. Here you can see the Latin language which is written. The translation into English means medicines nourish the body and health is maintained. Into bracket, or a small quantity ingested, it makes the sick person come back into a state of health. The change produced is called a medicine. So therefore he says that with the help of medicines, the health may be maintained and the medicines nourish our body. Or if you take a small dose of the medicine which is ingested, it makes the sick person come back into a state of health. So when the patient is sick, a small dose of the correctly indicated medicine will bring him back into the state of health. This change produced is called as a medicine. The questions put forward are: on what grounds is any substance considered as a medicine, and how to ascertain the disease condition it can be favorably modified? The answer is that there are 2 ways to arrive at such conclusions, namely the empirical and the rational. Now let us see what do we mean by empirical and rational. If we take the empirical method of prescribing, most of the medicines used are just found by chance or luck. So basically, empirical method, it deals with the medicines which are just found by chance or luck. That means what? No proving was done, no substantial data was there, no truth was there in their materia medica, but these medicines, they said, were useful to treat certain conditions. So they had certain theories, certain hypotheses on which they used to base the medicinal knowledge. And if by luck or by chance it was found useful, or it was just a coincidence that after giving the medicine, the patient improved, that could be by luck or by chance. And so they claimed themselves as rational physicians. Many of the professional healers have adopted this sort of practice. So during Hahnemann's time, most of the professions or the professional healers had used this method of empirical method of prescribing. Cinchona bark for ague fever, spongia for goiter, arnica for effects of falls and strain, sulfur for itch, etc. So basically, these were the remedies used, and like for example, cinchona for ague fever, and it cured ague fever. Why? Because these medicines, just by luck or by chance, they prove useful. Thus, the empirical method is a very uncertain one, as it consists of guesswork and chance. So basically, the empirical method, it just lies on a hearsay or a guesswork, and just by your luck or your chance. The rational mode of selecting the remedy is done by the process of drug proving. So this is the main difference. In the empirical method, it is left to the chance, it is left to luck, it is left to an hearsay, it is left to a hypothesis, it is left to a theory. But in the rational method, it deals with the truth. And the rational method, you can have the knowledge of medicine by the process of drug proving. Richard Hughes emphasized also the pseudo-rational mode of discovering remedies. That is, the doctrine of signatures is one such mode. So, Dr. Hahnemann, besides having the knowledge of medicine on the process of drug proving, Richard Hughes also said there's another method, that is the doctrine of signatures. But that was a pseudo-rational method that wasn't accepted by everybody. Hahnemann, in essays on suggestions in 1796 and examination of the sources of common materia medica in 1817, has fully considered the empirical and pseudo-rational ways of arriving at the knowledge of medicine. So, in these two articles, you can see that Dr. Hahnemann has mentioned something about the empirical method as well as the pseudo-rational ways of arriving at the knowledge of medicines. He further says that the polypharmacy and lack of individualization was the essence of treatment. So whatever treatment the professionals were giving during that time, basically they were on multiple dose stimulation, or they were on rather not multiple dose stimulation exactly you can say, but you can say multiple medicines were mixed up and given. That is polypharmacy, and naturally there was no individualization. So that was the essence of treatment. More than one drug, and just giving the drug on a hearsay or on a most empirical method. He concludes by saying that none of these sources is trustworthy. So naturally, if you just have a theory or a hypothesis, or you leave it to luck or leave it to chance, then naturally these sources are naturally totally untrustworthy. The sources are totally, you cannot trust these sources. The only trustworthy source is by proving the medicines on healthy human beings. So the only way to trust the complete knowledge of the medicine is to prove the medicine on the healthy human beings. Richard Hughes says that the effect of drugs can be ascertained in lower animals and also in man. Now, as you all know, Richard Hughes was a grand old man of homeopathy. He always differed from in some aspects from the Hahnemannian method, and he was bold enough to say that you can also have the knowledge of medicines by seeing the effects in lower animals. Hahnemann rejected the theory of proving on animals, as the effect of drugs are different on men, on animals and on man. So Hahnemann totally rejected the theory, saying that you cannot prove it on animals, as the effects on animals are different and the effects of man are different. Hahnemann states that an example of a pig which can ingest a large quantity of nux vomica without injury, and yet men have been killed with 15 grains. So that is why he says the drug effects are different on animals and men. He gives an example of a pig. A large quantity of nux vomica can be ingested by a pig, whereas if you only give a small amount of 15 grains to a healthy man, you can kill him. Moreover, in the 41st volume of the British Journal of Homeopathy, contradictory results were obtained of pharmacological results on animals. The main reason for not allowing the proving on animals was that you cannot obtain subjective symptoms from these dumb creatures. So naturally, if you prove it on animals, whatever they are feeling, those symptoms cannot be obtained. Why? Because they are dumb creatures. In homeopathy, it's very important to ascertain the mental symptom of a person in disease, and we have to find a corresponding drug exhibiting these symptoms, which we obtain by drug proof. So, in homeopathy, it is very important that the subjective symptoms are taken into consideration, especially those on the mental sphere. So, if you prove it on a healthy human being, you will be able to elicit all this correctly. When you prove a drug on animals, you have to administer large physiological doses of the medicine. So this is another difference, that if you prove the drug on animals, you have to use large physiological doses. Thus, proving on animals is not allowed for ascertaining the properties of a drug. If we use the homeopathy principles of drug proving, we administer an infinitesimal dose and can be carried out over a long period of time without causing any harm. So naturally, if you use the large physiological doses on animals over a period of time, you may kill the animal, or it may be toxic to the animal, and the animal may die. Whereas in homeopathy, we are using very minute doses known as infinitesimal dose, and you can carry on for a considerable period of time without causing any harm, because the dose is very extremely small. In this way, Wegener had ascertained the power of phosphorus to induce plastic irritation of the periosteum and of the intestinal tissue of the stomach and the liver. Eugenie Curie had shown Bryonia capable of exhibiting pseudomembranous deposits and Drosera that of the tubercle. Thus, experiments on animals are subject to analysis and interpretation being carried out by the experimenter. So this is very important. When you prove it on animals, whatever analysis you are doing, that will be on the interpretation carried out by the experimenter. That whoever is carrying out the experiment, he will interpret it in his way. So, if one fellow does a proving on one animal and another fellow does a proving on the second animal, both these interpretations will differ. Thus, such experiments are of subsidiary value. The action of a drug on human body are the main source of knowledge. So again, he always reminds you that the main knowledge of medicines can only be got through the drug proving. That's the only correct source. Richard Hughes says the knowledge must be gained by this source and elsewhere by observation and experiment. So therefore he says that Richard Hughes was quite open-minded, and he said that you can not only prove it on healthy human beings, but by other sources also you can see the effects of the medicine, that is on animals. However, observation in the field of poisoning of healthy and overdosing of sick person require separate discussion. So therefore he says that observations related to the poisonings and overdosing of a sick person will require separate discussion. So he hasn't elaborated on this point at all. Poisonings are limited to a small class of drugs which have the virulence to produce such effects, and it induces more violent disturbances, and post-mortem changes can show the induced changes when proved on animals. So therefore he says that a small group of drugs are there which may be poisonous, and as a result of which they have their virulence to produce such side effects, and if such poisons they produce because of the virulence violent disturbances and they kill the person or they kill the animal, the post-mortem changes can show the changes what are taking place in the animal which is killed. It helps us to obtain the similarity of seed between drug action and disease. So therefore, pathology or the post-mortem changes will help you to obtain the similarity of the action of the drug and the disease. Thus, records of poisoning and works on toxicology have always been largely employed from Hahnemann downwards. Overdosing is practiced in traditional medicine. The object of antipathic and allopathic medicines are to produce large physiological actions of the drug and development of collateral effects. So therefore, he says that overdosing is seen generally in the traditional medicine or in the empirical medicine, where large physiological doses are given over a prolonged period of time. So he gives an example of the antipathic method and the allopathic method, in which large physiological doses are taken and the development of collateral effects. Collateral meaning the side effects. The older traces of materia medica have effects collected due to these excessive dosage. So if you go to see the older traces of the materia medica, they have their collection is based on these excessive massive side effects of these excessive massive doses. They form Hahnemann's early source of symptoms. Now we focus our attention on experiments. Haller's insight has perceived first to see effects of medicine on on a healthy body without any admixture of foreign substances. So as you all know, Albrecht von Haller, he was the first person to discover drug proving, or to discover the theory of drug proving, but he did not give any practical interpretation. It was Hahnemann who took Haller's point and gave its practical interpretation. So therefore, Haller was the first to see the effects of medicine on a healthy body without the admixture of any foreign substance. That means a single simple medicine had to be given for the process of drug proving. Alexander and Stock had tested many substances to ascertain their dose and effects, but without any success. So besides Haller, Alexander and Stock also, they knew about this, and they also started testing many substances regarding the doses and the effects, but they were not at all successful. However, Hahnemann gives practical application and was successful in proving a total of 99 drugs in his lifetime. The results of Hahnemann in proving were given in the Fragmenta in 1805 and in the first volume of the first edition of Reni Archnetimezellheri in 1811. Hahnemann started proving drugs on himself and also on his family members. Soon he had a good number of followers who helped him to do the provings. So the first result of all his provings were given in the Fragmenta de Verbis Medicamentorum de Positibus in 1805 and also in the first volume of the first edition of this German publication in 1811. Little has been known regarding the dose and mode of administration for proving of drugs. In Fragmenta, the dose used was a single full dose. In the provings of Reni Arzneimittel were conducted with the first trituration, wherein repeated small doses were given until the effects were produced. Later on, Hahnemann came out with his views on the dynamization in chronic disease, the second edition of the sixth volume in 1827 and fourth volume of the first edition in 1830, the 30 dilution was used. So Hahnemann, in order to ascertain the knowledge of disease, he wanted to keep an standardization. So therefore, he used only the 30 dilution. In the fifth edition of Organon in 1833, Hahnemann recommends that the proving to be made with 30 dilution as it yields best results. Even substances which were inert in their crude states were roused into activity by the peculiar process of dynamization. So Hahnemann said that even substances which were totally in the crude state, they had no, rather they were totally useless. They were roused into activity by the process of dynamization, or they became important drugs when they were dynamized. These symptoms obtained were dependent upon the special susceptibility of the person who was proving a particular drug. So naturally, susceptibility will play an important role to see how many symptoms are produced in a healthy prover by that particular drug. The mode of presentation of proving of Hahnemann was done in the anatomical schema, proceeding from head to extremities and ending with generalities and physical phenomena. So the proving schema of Hahnemann was in the anatomical schema, right from the head to the foot. Whatever symptoms are pertaining from the head to the foot, they are written down in order and ending with generalities and the physical phenomena. So the means of observation and the time of occurrence of the symptoms were given. The names of observers and the time of occurrence of symptoms were given. However, no information regarding the connection and sequence in which they occurred had been mentioned. Hahnemann in his later years made two large uses of patients for eliciting symptoms. When a deviation of health disappeared under the action of the drug to be proved, Hahnemann took it to be the curative action of the drug. This did not go well with the disciples and they objected. So therefore, when Hahnemann in later years, he made use of many symptoms to elicit the drug proving. So meaning when a healthy prover was so-called healthy, and say suppose he had bronchial asthma, but at present he had no asthma, so he is considered healthy. And when he took the drug and when the asthma had been cured, or after taking the drug, the bouts of asthma completely stopped, he took it as a curative action of the drug. So this did not go well with his disciples, and the disciples objected. Dr. T.F. Allen's work on materia medica was seen in 10 volumes, which had the same schema as that of Hahnemann. Dr. Allen had a rich record of provings, which he did not include, and also he did not include the record of poisons in Hahnemann's arrangement. Dr. Allen, in his last volume, he regrets this. Thus, the trustworthiness and accuracy was under question, so it was decided that the work must be done all over again. Thus, the British Homeopathy Society, along with the American Institute of Homeopathy, took up the work to construct a new materia medica. In 1884, this task was taken in hand and was completed 1891 under the title Encyclopedia of Drug Pathogenesis. It was a genuine work, as all versions and copies were traced back to the originals and verified, corrected or reproduced their form, and all the clinical symptoms and supposed milious aggravations have been excluded. The phenomena observed in patients taking drugs were accepted only on sufficient evidence as proving themselves has been critically scrutinized and not admitted until their source and method seem free from objection. The work was also intelligent, as all observation experiments had been related in detail or sufficient summary as to preserve the order of the evolution of the drug effects. So the evolution of drug effects were maintained. In the old days, many new systems of medicine grew and fell as the treatment was different and the options were endless. So in the olden days, as you all know, during Hahnemann's time, there were many systems of medicine. Each system had its growth and its fall. Why? Because their treatment was different and the options were endless. So many opinions were there. There was a need of system medicine which would bring peace in the chaotic field of medicine. So therefore, there was a need of a stable system of medicine which would be trustworthy, which would be genuine, and it would bring peace in the chaotic field of medicine. Thus, homeopathy grew, and as it was based on truth and not merely on false theories. Drugs were proved on healthy human beings, and the law of similars was used to treat disease. So, why did homeopathy grow? Because it was based on truth. Drugs were proved on the healthy human beings. The materia medica pura was pure, and the law of similars was used to treat the diseases. This new system brought stability and peace in the chaotic field of medicine. So, therefore, this system grew. Its popularity grew because it was based on truth, it was stable, and it was quite efficient. So that's all what Richard Hughes wants to tell you in this lecture. Thank you for listening, and please to subscribe, share, like, and comment and forward. Thank you very much.